Hi everyone, this is M.B.B.S nerd, and this video I will be talking about acute prime promyelocytic leukemia. So let's begin, or also called the M3 leukemia. Now, acute myeloid leukemia was the accumulation of immature myeloid blasts due to impaired differentiation, which was caused due to acquired oncogenic mutations. But acute promyelocytic leukemia is the M3 subtype of the French American British classification of acute myeloid leukemia. So, what is the pathogenesis of acute myeloid leukemia? As you see that there is translocation between chromosome 15 and chromosome 17, which ultimately leads to impaired differentiation. So basically a segment on chromosome 15 translocates alongside the chromosome 17 segment, and that leads to basically they code for a genetic product, this fusion gene, which leads to impaired differentiation. How we will look that in this picture. So normally in a granulocyte progenitor, this RAR alpha protein is attached to a repressor, which ultimately leads to transcriptional repression. But when retinoic acid or the active form of vitamin A binds to this RAR alpha or this transcription factor, then this repressor is not able to bind to it, and this activator protein binds. And this ultimately leads to gene transcription, which leads to the differentiation of this progenitor, and that results in a normal maturation of these cells. But in acute promyelocytic leukemia, this translocation leads to formation of this fusion gene, which is also called PML RAR alpha fusion gene. As you can see here, this extra protein has been attached, so this strongly binds the repressor even after binding retinoic acid. This leads to transcriptional repression, which ultimately leads to the accumulation of these myeloid blasts. Now, and this leads to acute leukemia. Now, the clinical features here. So, the clinical features what we see are anemia due to bone marrow infiltration and the death of erythrocytic progenitors and fatigue. Recurrent infections are seen due to neutropenia, and bleeding from mucosal surfaces are seen due to thrombocytopenia. They are also called petechia. So, mucosal surfaces, especially the gums or the GIT, we see a lot of, you can say, bloody stools are seen, and we can also see easy gum bleeds in these patients. Ecchymosis can also be seen. Ecchymosis are the bruised areas on the skin which occur due to thrombocytopenia, and that is also very common here. And metastasis to different tissues is rare as compared to acute lymphoblastic leukemia. Now the complications. The complications is disseminated intravascular coagulation. We'll talk about this in detail later in uh, our videos, which will be specifically about disseminated intravascular coagulation. So this is due to the release of procoagulant and fibrinolytics. Now basically, if I give you an overview, then procoagulants cause the consumption of coagulation factors, and this leads to thrombosis, increased consumption, and fibrinolytics causes the destruction of these coagulation factors. So what you can see, that first of all these coagulation factors are being consumed rapidly, now they are being destroyed also, so this leads to their low levels in the blood, low levels in blood, and this again leads to massive bleeding, internal bleeding especially, and can cause fatal hemorrhage. Now fatal pneumonia is also seen due to decreased immunity complications. Now, if we talk about the diagnosis, then diagnosis is done by taking a peripheral blood smear or a bone marrow aspirate. And the blasts if the blasts are more than 20% in the bone marrow, then that confirms that patient is suffering from leukemia. Bone marrow aspirate on the top of a peripheral blood smear helps us to confirm and make our diagnosis solid that yes, the patient is suffering from acute promyelocytic leukemia. And we see numerous promyelocytes having a large nucleus and a voluminous cytoplasm, as you can see here. And also this nucleus is bilobed and shaped like that is what is also called, they are shaped like a buttock. That is why, I mean, yes, it's a bit inappropriate, but yes, it does one of the very common resemblances. It does resemble to a buttock. And we also see that there are numerous azerophilic granules in the cytoplasm. Now, what are these azerophilic granules? So these are basically the hydrolases or the different lytic enzymes or the myeloperoxidase enzyme, which is involved in the killing of microbes. And as you know that myeloid cells require, just like the neutrophil, basophil, eosinophil, they require these enzymes to destroy foreign substances or foreign organisms. That is why. Also, we see multiple cells with bilobed nuclei having numerous OR rods or needle shaped, these are needle shaped eosinophilic inclusions containing this enzyme, or also called the myeloperoxidase enzyme. As you can see here, these needle shaped inclusions, these are our rods. And the IHC markers or the immunohistochemistry markers are positive for CD34, which is most commonly seen in stem cells. And MPO is also positive. This enzyme, myeloperoxidase enzyme, we specially use stains for this MPO enzyme, and that confirms that our cell is from the myeloid lineage. Now, if I talk about the treatment, then as you can see that generally there is transcriptional repression due to this chimeric protein produced by the fusion gene. But when a special kind of compound called the all trans retinoic acid, which has a kind of a different structure from the normal retinoic acid, that is given in this concentration, then this easily binds to this chimeric receptor and ultimately leads to the binding, it strengthens the binding of this chimeric protein to the activator protein, and this ultimately leads to the differentiation of these malignant promyelocytes into short-lived polymorphonucleosides, and that leads to the hematologic remission. So that is why this leukemia is very important for us to study, because it is easily curable, and we see a very unique kind of chromosomal translocation in this kind of leukemia, in this M3 leukemia. So yes, this was a treatment of acute promyelocytic leukemia, all trans retinoic acid. So I'm ending my video today, and in the next video I'll be talking about chronic myeloid leukemia. If you like this video, give a thumbs up, comment on the comment section, and